Alright, just on my walk, I've been seeing some more overweight people training for work. I was watching this small group of 4 to 5 construction workers. Half of them are overweight. There was a really large black guy, and they were all learning construction methods. I think that's a disaster. You know, Trump had a plan for getting health care solved first as a part of his tax reform package to relieve taxes burdens for the small businesses and businesses. And if it's not going to go in order, then there's going to be some kinks, some terrible kinks in the system with the health care. But I have to say, I don't believe he's going with healthcare in the right direction, but he's trying to improve it because we have a lot of obesity. That has not been addressed by Trump yet. That's too bad. He really needs to address this obesity epidemic because that's going to cause, that has been causing, alright, and will cause even further damage to the economy because obese people just, if we're working on their feet, they have more problems, alright? They're carrying around that excess weight, and it's not just like you're carrying around excess weight, it's also stagnation on all your organs, and just suffering the addiction of hunger too, by consuming all that excess sugar extract. That's what really needs to be a part of the healthcare package. That needs to be the forefront of it, is really going after these sugar companies and taxing them and having sugar reduced, having even that fake sugar reduced, okay? Reduced or just eliminated, because that sugar added to things is unnecessary, okay? It's just so unnecessary, and it's just been a way for manufacturers to cheat the system and create addicts for their food products, because there is a big difference between eating a slice of bread with sugar added and not sugar added, okay? People will eat more. That's how Wonder Bread got so big, is because of the added sugar, the extra added sugar. You know, it's no wonder anymore. They called it Wonder Bread at one time. They didn't understand the addictions back then that sugar bring, and that's been a major problem for the healthcare system, and that's what needs to be addressed. These overweight workers are obviously clear signs that there's going to be some serious problems with growth in our economy, with production value. I mean, overweight people have a tendency to call in sick more often. They have a tendency to get tired easy. You know, there's just so many. There's that metabolic syndrome, that whole host of things that are causing issues, okay? It's too bad that it's got to be like that. It's too bad that we have to continue on trying to ignore that bull in the china shop with the sugar industry. And Trump, of all people, of all the potential leaders who could do something, a guy who kicked out those special interest lobbyists from Washington for 5 years or something, just to take away that influence, okay? So he could have a clear head on what he believes is the best path for America to go, and yet totally ignoring the one aspect of our health crisis that is causing the worst problem, and that's the sugar industry, okay? Maybe he does have the sugar industry in his back pocket. Maybe there is that potential. Maybe that's why he's ignoring that. Because I mean, there are a lot of problems in America to work on the infrastructure. Which, you know, he's no expert. He's no health expert, and even his own health experts sound like they're not going to do much. It just troubles me to see. It feels like such a waste of time to train these overweight people, because they're like pregnant women. I mean, I'm talking severely obese. Like, they have to work very limited. You can't give them a full range of work, like normal people.